So I'm going to talk about location and actually urban design. This is actually images of all the places that I could remember where I lived for more than a year. You can see in the top left-hand corner, that's where I grew up, and it's actually been downhill ever since. Some of these have actually been become gentrified, and one of the ones in the middle, there's a big hole in the roof. Another, there was an invasion of slugs every time it rained. During the course of this time, we've had a revolution of data, often from satellite information, which tells us about our surroundings. And we can do this actually for everywhere in the world, and actually where we are today. We have images, and we can actually look at the amenities and the features around this. Most of my work is in air pollution, and this is actually an image of Vancouver at noontime in 1940. This actually wasn't unusual for the time, and it's actually still common in many parts of the world today. Because I don't have this kind of air pollution to study today, I got to thinking when we were studying Vancouver, which as you can see is much cleaner today, and actually much cleaner compared to other cities in North America or certainly cities elsewhere in the world, for example, in Asia, that we should also look at what about differences actually within a city, even a very clean city, and actually do we see differences based on where people are in the city and their health. So we set up a research program actually doing measurements, maybe hundreds of measurement locations around the city by a number of different approaches, and then taking the features of those locations and understanding the geography, what's around those locations where we're making measurements, putting the two pieces of information together and developing models. So here's an example of a very high resolution model where we can actually look on a 20 to 30 meter difference and actually understand the levels of air pollution, where somebody lives, where they're spending their time. We also did the same kind of thing. This is focused on traffic pollution, but we've also done it for other sources like wood burning. This is a picture of one of my partners in crime, Tim Larson. Tim convinced me to actually drive around between midnight and 4 a.m. in the morning on cold winter mornings, and we collected 12,000 data points of where there was wood smoke pollution around the Vancouver area. Also learned a lot about what goes on between 12 and 4 in the morning. Next talk. We put this kind of information together in a model where we combine it, linked it with other spatial data, such as locations of fireplaces in homes that we get from property assessment data. In fact, it's very interesting. If you can look at property assessment data, you can learn a lot about your neighbors. Took this environmental data and combined it now with health data, administrative data from physician billing, vital statistics, et cetera. And what links the two is residential location, and in fact, residential histories that we can compile. So when we put these together, we learn a lot of things, and we learn things about traffic pollution and all of these health outcomes that are associated with it. And actually quite surprising, things that we didn't ever really consider might be related to air pollution, things like middle ear infections that are related to exposure to air pollution depending on where you live and spend time. The same kind of thing for wood smoke, another source of air pollution. And in fact, now we can see differences actually between the types of pollution and the types of health responses when people are exposed to those sources of pollution. So when we put all this together, we also have another thing that we can do is actually now we can actually take the information because of people's contacts with the healthcare system and actually understand where they've been. So if I didn't remember where all those houses that I lived, actually the government knows based on my contacts and what I report as my address. So we actually created residential histories for the population, and we can now use this to design natural experiments. So for example, we can set up a group who for the whole time we're following that was not exposed to traffic-related air pollution, a group that was always exposed, and more importantly, people that moved from a high or a low exposure category. And what we actually see is that there's certainly a function of risk depending on what people's exposure was, but more importantly, that actually people who moved away from traffic during this period of follow-up actually decreased their risk. Similar to people who never were exposed. So this is like smoking cessation, it's traffic cessation. Now, of course, people actually can't move away from traffic, but we can actually move the traffic away. And here's an example in Munich, a high traffic road that was actually created into a linear park where they tunneled the road, filtered the air pollution, and now you actually have a nice corridor for biking, and walking. Air pollution isn't the only thing that defines the environment of our cities. We've also got noise. We've got things like the amount of green space in a city. Both of these are related to health. And we also have how walkable or how bikeable a neighborhood is. And that actually leads to higher levels of physical activity, which we all know is good for us. Unfortunately, when we put these kinds of things together, we actually see that they may cancel each other out. So this is a map where we looked at walkability and air pollution, and all the white areas are actually places where things are neither good for air pollution or they cancel each other out in terms of being walkable or not. And in fact, the gains that we may see are canceled out by another risk. We also see actually that some of these risks work together. And independently, for example, noise and air pollution both lead to increased levels of cardiovascular mortality or low birth weight. So both risk factors that work against each other or also work towards each other. Also looking, for example, at green space, we see independent effects after controlling for noise, air pollution, walkability. Green space still has an independent effect where it actually promotes a higher birth weight and less preterm births among people who live in areas with more trees and more green space. So when we look at all this together and we look back at where have I lived, I didn't make any decisions based on what was healthy. It was what was cheap, what had the less slug invasion or no hole in the roof. But this is really what we need to be thinking about when we're designing our cities, to make them clean, green, quiet, but not boring, walkable, and then all the other things that we all typically consider. Thank you.